Um, I think I'm audible. Good evening to all. So today's remedy will be Belladonna. Atropa Belladonna, the full name of the remedy. It's a very common remedy that we all use in your daily clinical practice, and this is how the drug looks like. Very characteristic shape of the flower. So it belongs to the family Solanaceae, which you have a lot of important remedies. All the addictive remedies can be thought in this particular family. You have trio of delirium, where delirium of belladonna itself is very important. You have you have trio by belladonna, hyoscyamus as well as stramonium, where belladonna is known for its violence. You have hyoscyamus for its lasciviousness. You have stramonium for your religious mania. Alright, so try of mania, try of delusions, delirium and all, you can think of the three remedies, all three belonging to the same family, Solanaceae. You also have dulcamera, tabacum, as well as solanum, lycopersicum. This is nothing but your tomato. Okay, so part used here is whole plant. It is actually the fundamental rule for class 1. In old method belongs to class 1 obviously, and in new method its drug strength is 1/10. Okay, common name being deadly nightshade. Speaking of the constitution, I think that's pretty clear with the tubercular patients being highlighted. So imagine a child or a person who is very lively when he is healthy, but during sickness he'll be very violent and delirious. Okay, so that's how the description goes. So you have a very fair kind of person that's actually expecting. It's also known as beautiful lady, which we describe for belladonna. So women or children with light hair, blue eyes, fine complexion, delicate skin, sensitive, nervous, threatened with convulsions, and they are basically tubercular patients. Okay, going ahead, you have mental generals. Please see the photos. I think should be pretty clear from the photos that they have, in delirium they tend to picturize these things in their sleep or whatever it is. They feel they are seeing visions of black animals, dogs, wolves, and various insects, hideous faces, ghosts. So this is how it goes. Fear of imaginary things. So you can't actually explain each and everything here. So that's it. And then you have a combination with veratrum. So I want you to remember the remedies belladonna, hyoscyamus as well as stramonium. And then after reading all these three remedies, please go and read veratrum album so you can understand how it's very interconnected. You can see almost every feature in veratrum itself. Okay, so again we said belladonna is known for its violence. So violent delirium, disposition to bite, strike, spit and tear things, breaks into fits of laughter and gnashes teeth, want to bite and strike the attendants, and try to escape. Okay, just like a helleborus. Now again, helleborus is a remedy that can be compared with belladonna in terms of encephalitis or meningitis kind of features. In physical generals, you have a very sensitive person to cold. So again, tubercular patients, so they are prone to take up upper respiratory or lower respiratory infections, or whatever ailments that can come up. So something very disturbing for a belladonna patient is draft of air. Now imagine some person who is riding a motorcycle without helmet. And the next day he comes up with cold, common cold like features. You can think of belladonna as well as aconite, hepar, as well as restox. Okay, so that's basically 4 important remedies that you need to remember. Also, you have, comparison with your conium, cuprum, and silica, where you get cold from exposure of feet. Okay, so here it's basically exposure of head, I guess, because it's basically uncovering the head. Okay, and there is quick sensation and motion, eyes snap and move quickly, pain comes suddenly, lasts indefinitely, and cease suddenly. A comparison that is given to MacPhos. Also, you can add, eupatorium, you have carbolic acid, petroleum, to an extent I think aconite also. Okay, so pain in usually short attacks cause redness of face and eyes, fullness of head, and throbbing of carotids. Now, why throbbing of carotids? Because all these things are, again, this violence comes with some kind of congestion also in Belladonna, so that's why you can see this redness and throbbing of carotids. Okay, in headache you have a congestive headache, but before that let's see the vertigo part, where you can see vertigo when stooping or when rising after stooping, comparison to bryonia, and on every change of position. So all these things, again, belladonna, bryonia, conium, all these can be thought in conditions like BPPV as well as Meniere's disease. Rush of blood to head and face, and other congestive remedies are listed here, like your amyl nitrosum, glonoin, melanotis. So all these remedies have this rush of blood to head and face. Congestive headaches with red face, throbbing of brain, and carotids. Your aggravating factors are, your modalities are pretty important here, because this again will be dealt in your last part. So I think this should be cleared here itself. So slight noise, light, motion, jar. What is jar? It's basically very violent shaking. Okay, so that is there. Then you have problem with sun, so sun headaches can happen. Then you have least exertion, even headache after a haircut. You can think of belladonna. And how it's relieved? It's by pressure, tight bandaging, and wrapping. Okay, also you have headache better during menses. Okay, so that is something pretty interesting here. So during menses, if the headache is better, you need to remember your belladonna. You can compare with actiorismosa, where there is aggravation during menses. You can remember your sepia or creosotum, where you have headache before and during menses. All those kind of features can come up here. So that goes the comparison. So in belladonna, it's headache better during menses. Okay. Going ahead, your encephalitis feature is coming again. It's your boring of head into pillow. Okay, Epis, helleborus, as well as podophyllum. All these questions are pretty important, and they tend to come in exams. So that's why I've highlighted in different colors. In GIT, you have appendicitis-like features, where you have a right iliac fossa kind of pain. Again, the modalities had been already described. So jarring, touch, everything is very sensitive for belladonna patient. Even the contact of a bed cover. Okay, so again, cross compare with your muriatic acid, where hemorrhoids are described so sensitive even to the toilet sheet. So I think you can compare the sensitivity even to the bed cover to muriatic acid also, but please remember the pathology is different. Okay, and the last symptom, transverse colon protrudes like a pad. Okay, that again can come as a single line remedy. You can't see anywhere the symptom else in Metromonica, and that's it for your belladonna. In females, you have this, as if the contents will push out through the vulva, and it's better during standing as well as sitting erect. A very important modality of Belladonna that you need to remember. Other three remedies, prominent remedies that you need to remember for this prolapse kind of feature is Lilium twig, Murex as well as Sepia. In nervous system, you have febrile convulsions like symptoms where you have convulsions with fever, and you can also see convulsions during teething. Okay, so again, MACPHOS being compared here, MACPHOS as well as Belladonna has complaints coming quickly and leaving suddenly, but MACPHOS does not have fever, but Belladonna has fever. So that speaks the importance of Belladonna for a pediatric point of view, where it is frequently indicated in febrile convulsions like situations, and comes on suddenly. The head is hot and the feet is cold. Okay, again remember arnica for this matter, where head is hot and the body is cold. Okay, so that's something you need to cross compare with arnica. In fever, you have a lot of modalities. Characteristics, not modalities, characteristics that you need to remember. It's a high grade pathology happening in Belladonna. The secretions are decreased, so you can see the stool and urine being suppressed. The mucous membrane is dry, so please remember, headache, the fever is high grade. Usually it should be attended with thirst, because high grade fever usually demands fluid intake, but Belladonna shows thirstless kind of feature. So thirstless during fever can be again Belladonna. Okay, and then again if you go to that level where pupils are dilated, okay, it can go to some kind of encephalopathy and all. So then you can see all these features where eyes wild, staring, pupils dilated. Now in fever, we know there is tachycardia and all. So pulse is full, bounding, globular, like buckshot striking the finger. So all these things, when you study, please try to go for the pathology wherever possible. I think I am pretty clear here. And also you have a fever along with sleepiness but cannot sleep. Seen also in Camilla as well as opium. These are basically the features of scarlet fever. You can see the strawberry tongue, again seen in Belladonna. You have a smooth, reddish macular eruptions for your scarlet fever. Skin uniform, smooth, shiny scarlet redness, dry, hot, burning, imparts a burning sensation to examining hand. So that's the level of heat that is imparted from the body, and the eruption is perfectly smooth and truly scarlet. From boric, I think the great children's remedy, the important symptoms are already listed here. Something I need you to remember is no thirst with fever, strawberry tongue, headache from having a haircut. Okay, I think that's it. Continual, inclination to swallow. So all these things are seen in Belladonna. Modalities we have already discussed. Okay, aggravation 3 p.m. is there, something you need to remember. 3 p.m. as well as night aggravation is there. Complementary to calcaria, some very important question. Belladonna is the acute of calcaria, which is often required to complete a cure. Okay. Question that you need to remember, this is what I have already said. Okay, pain comes quickly, goes suddenly, carbolic acid, petroleum. The list it continues, like aconite, Belladonna, eupatorium, petroleum is there, carbolic acid is there. Pain comes suddenly, leave gradually. It's not platina, it's actually pulsatilla. So the wrong pair is answer B, and the symptom is pain appears suddenly, leaves gradually is pulsatilla. You also have a cross comparison in sulfuric acid, so it's like it has both features. Okay, rest is pretty properly matched. Stanamet as well as platina has this pain increase gradually, decrease gradually. Convulsions or spasm during teething is seen in all except cicuta, Belladonna. Okay, the answer should be Sorinum. Rest all have convulsions during teething. Thank you.